Good afternoon, you guys. This is Dr. Shannon Clark with Babies After 35, and I will be joined shortly with Dr. Kathrym España. She is a pediatrician and also the owner of Concierge Pediatrics in Houston, Texas, and we are going to discuss the baby's first year of life. So I'm going to wait for her to join me, and then we will pick this up. Wait to get a clue that she's on. Still waiting. I haven't seen her pop on yet. Oh, there we are. Okay. Here we go. She should be joining soon. Oh, maybe not. Let's see. Oh, hi.
Hi, hey, I don't see you. It says connecting. Hold
Okay,
on.
so hold on. Let's see. There you
There
are.
we go. Can you see
Hi
me now?
there. I can see you. Good,
Okay,
good
good.
afternoon, I should say. I've
Yes.
already introduced you. So this is Dr. Kathrym España. We're going to jump right in because I know you have another commitment. So I want a good 40 minutes with you or so.
Sure.
Thank you for joining. And I just of note, my son, he's 4.5. He just lost his first tooth.
At 4.5? That was
Yes,
pretty
but
young.
he cut his first teeth at 4 months. He
Yeah,
had
so
two
did my
teeth. Yeah,
daughter. You're right. And
yeah.
they tend to move a little bit quicker. So yeah.
Yeah. So he just lost his first tooth, but we can't find it, so I think he swallowed it. But we're not going to tell him that because he'll freak out.
You
Okay,
might find it in a couple of days somewhere.
that's right. I'm sure, but I'm not going to give that idea to him because I don't want him looking for it that way. So, okay, so let's hit it. The first thing I wanted to talk about, and we're going to discuss several topics concerning the baby's first year of life. Okay, the first thing that I want to talk about is knowing how much your baby's getting. For me, I had preemie twins. They were in the NICU for 5 weeks and 6 weeks. They never latched, and they were too little, and I was, too stressed out. I wanted to know exactly how many ounces they were getting, so I chose to pump and then bottle feed, which is reasonable. But for those that are breastfeeding, how can you know in those first several weeks that a baby is getting enough hydration via the milk? Because I've heard of cases where there was some deaths of newborns from dehydration, and I get a lot of questions about that. I'm not an expert on that. So tell us, how can you tell that the newborn's getting enough nutrition?
Yeah, it's an excellent question. And that's actually one of my first videos, on my series that we talked about that we'll talk about later. But essentially the best way to know ideally is by counting wet diapers. So by day 3 or 4, your baby should be having at least 4 wet diapers a day and pretty full. I mean, nowadays, because the diapers have that little like blue line that didn't exist, like when my kids, my daughter's 14, that didn't exist. Sometimes if a baby like has like a drop or something, that blue line turns on and they just assume, oh, she peed. But when you look at it,
There's not a lot there.
And there's not a lot there. So it should be like a wet diaper. So if you did not have a blue line to tell you, you should like look at it and be like, okay, it seems heavy and it's wet and they're going to the bathroom. And so they should be having at least 4 wet diapers a day. So when people say to count wet diapers, that is a good way. Also stools. When the baby's first born, the stool is that like meconium, dark, black, tarry looking, nasty thing. Eventually that's going to change colors. By day 2 or 3, it might start being more greenish. Definitely by about day 4 of life, usually, then it starts turning into like a mustard yellow color with seeds in it, and it's fairly liquidy. So when it turns that color, then you usually know your baby's drinking enough, because it has to do with how much they're taking as well, changing the color. Okay. And so those are 2 things that you can sort of look at how your baby's going. But most importantly is that you should have a close follow-up with, a pediatrician and your doctor. So because we weigh the baby, and you can also have a weigh at home. So people that want to know exactly, and if you're working with a lactation consultant, there is such a thing as having a weight. And essentially you weigh your baby before you feed them, and then you weigh them after you feed them, and then you say, okay, they drank 3 ounces or 4 ounces.
Oh, okay.
Now, It's not as exact, if you can imagine, right? But some of these scales that lactation consultants use, they're a little bit more sensitive, where you can really exactly know 3 ounces, 4 ounces. So nowadays you can even rent some of these scales, and I do have some patients, if they are a little bit more anxious and want to know exactly, if we're working with them, they can weigh the baby before and after, and then they know. But again, if you have support from your pediatrician or your physician that's seeing your baby, ideally you should see them. I like to see them about day 3 or 4 of life after they get out of the hospital. And then at 2 weeks of life. And the goal is by 2 weeks of life, your baby should be back to birth weight. So every baby, again, this is all on term babies. Obviously, preterm, it's a whole nother deal. But every baby loses weight at the beginning, and that's completely normal. But the goal is back to birth weight by 2 weeks of age.
And so I think another important thing to, especially for new parents, knowing how to contact a pediatrician's office on those off hours to get a response. A lot of times the patient portals are great, where you can put the messages in if you have any questions, so that someone can get back with you if you're worried. But I also think it's a good idea, especially the new parents, to log. Like you said, I logged everything. I mean, we still have the booklets of everything that we logged. We were probably a little bit obsessive about it, but we also had preemies. But you can still do the same thing for term infants too, if you're just not sure. And it's always good, if you keep a log, you can also show that to your pediatrician. Have you ever had parents do that?
Absolutely. And nowadays, there's all kinds of really great apps. Parents are putting in, because you also, when you're first, another thing that I forgot to tell you, I mean, not like it's going to tell you how much they're drinking, but at the very beginning, especially the first month, and for sure the first 2 weeks, you need to be timing your baby when they're breastfeeding, if they're on on the breast. And so ideally we say about 15 to 20 minutes on each side, and literally you need to be timing it, like look at a clock and really know, because that's how long it takes for a baby to maybe transfer enough. So ideally every newborn baby at that age should be, and I'm doing any recommendation for good logs, I will get back at you, because I know I have them written down, but I can't think of it in the back of my head, but I will definitely get back to you with that, with the apps, okay? And so anyway, when you are writing it down, then you know that hopefully they're transferring enough, because ideally, just like you said, you pumped, most term babies are after day 3 or 4 of life should be taking about 2 to 3 ounces every 2 to 3 hours. But of course, if you're breastfeeding, unless you're weighing them, you don't know if they're really taking 2 to 3 ounces. But most of the time, if they're latching on correctly, and if they drink about 15 to 20 minutes every 2 to 3 hours, and they're having 4-way diapers, and they're having good stools, then you know your baby's drinking enough. Okay? And one last thing that I do want to say, because people always, seem to not understand this, or like don't, I have to sort of bring it up, is when we say every 2 to 3 hours, we count from the moment you start breastfeeding, not from the moment you stop. Because people think is from the moment you stop. So it really is almost every hour, if you think about it, because it takes 45 minutes to an hour to breastfeed, and then about an hour later you start it all over again. So 2 to 3 hours from when you start breastfeeding.
Okay, that's good to know. And that's kind of, well, again, I didn't breastfeed, but that's how we kind of did it. We just had, the schedules we had were insane. We had a whole poster board ready with the twins, but that's the only way we could keep things on track.
And then you don't remember, did I eat this one or that one? I know I do it a lot with twins, and sit down with the parents. You have to be a little bit more organized.
Okay, let's move on to the next topic. How do you know, or when do you recommend as a pediatrician, and when to supplement with formula? The first thing I want to say is it's not a failure if you have to supplement with formula at some point. It's not. There's a little bit of a movement on social media right now that's saying that your body is supposed to produce milk, and if there's something wrong with you. I want to put it out there right now that is not accurate. That is actually very shameful to say that to an individual. Not everybody produces milk the same way. And if you can't, and your baby does need to supplement, that is fine. It's fine. It doesn't mean you failed. Now, with that out of the way, how as a pediatrician would you recommend? What are some of the things that would make you say, you know what, you might need to consider supplementing with formula?
Well, I agree with you 1,000%. And I can tell you my own story. I mean, one of the reasons it's going to be if your child just somehow cannot tolerate breast milk. I had a child, my first child, first of all, I'm a cow. I produce tons of milk. You know, I do, and I know that. My first kid, she was like by the book, amazing, breastfed, did really well. My second child, I think God gave it to me to become a better pediatrician and to really understand a lot, which is one thing I usually tell everybody. I do strongly believe that your pediatrician needs to have children, because it's not the same to raise something that to kind of go through it. So anyway, with that said, my second child had horrible reflux. I mean, really bad. And he was just spitting up a lot. And I think he was overeating because I produced so much that he would spit up even more. So anyway, long story short, he was miserable to the point where I knew that when I fed him formula, and it's thicker formula for kids that have reflux, he was just a baby. And of course, hormonal, and as you know, when you deliver, and my husband, who's also an OB-GYN, who'd be like, he's happy, give him formula. And I'd be like, no, what do you mean? I have all this milk, I can't give him formula, because you start feeling awful, right? Like, it was natural, as a mom. And then eventually I did. 2 months, I gave up, and I said, you know what? He is a happier baby. He's not spitting up as much. He's not miserable. And so I stopped breastfeeding, and at 2 months gave up, even though I was producing like crazy, and he just drank formula. So one of the reasons is, if your baby cannot tolerate it, whether they're having really bad reflux, whether they might be having a milk protein allergy. So I have seen moms go through a lot, and us as pediatricians, we notice. So if your baby's a baby that's extremely fussy, or if you notice any blood in the stool, it's something your pediatrician needs to, work out and diagnose. But the kids that are diagnosed with milk protein allergy, sometimes the moms will stop all dairy, and they still have issues because it does cross-react with other things like soy and a bunch of others. And so it's to the point where it doesn't matter, what the mom's eating, the kid's still having issues. So then you need to do a special formula. Also, at the very beginning, just like I said, it's very important to be, with a good relationship with your pediatrician, from day one. So if your baby is losing, especially if they start losing more than 10% of their birth weight. So I said they always lose weight, but we don't like for them to lose more than 10%. So I am 100% 1,000 pro breastfeeding. But if your baby's losing too much weight, you need to supplement with formula, at least for the first few days, to make sure that we're not going to lose too much weight and we're getting into problems. And then lastly, sometimes it takes you longer to start producing milk. And your baby's miserable, crying. And I a lot of times say, give him formula. And the parents are like, wow, that fixed him. Like, he's happy, he's cool, and he's able to sleep. So I agree with you. Formula is not poison. I mean, I do know that sometimes nowadays in these baby-friendly hospitals, I think it's awful. They make you sign a waiver. Like, you're doing something bad to your child if you ask for formula. Do not feel bad. It is not the worst thing in the world. And, make sure that you just have someone to talk to be able to talk you through it. But those are the times that I would say for sure that you should start looking into formula.
That's really, really good. I gave them breast milk as long as I could. My son really ate a lot. My daughter did not, but eventually I did not produce enough, and I didn't breastfeed for as long as I wanted, but they got some, and that was the best I could do. And, even with that, and me understanding as a medical physician, there was always that little part I wish I could have done longer. But listen, you have to make sure that your baby's fed and happy and healthy, and is the most important thing. And I always think, thank goodness we have formula, and we have so many options for formula for those babies who do need it. There's so many different things we can use now, and it's there. And I was just grateful for that. So that's just something to consider as well. Let's move on to colic. Colic. What are you gonna first?
Sorry, there's questions coming up. Do you want to read those at the end?
We're gonna go at the end. I'm gonna go to about 12:35 and 10 minutes, or about 12:30, 10 minutes of questions. Okay. So next, what is colic? What can you do about it?
Right. So colic is simply a word, everyone hears about it, but essentially is when a baby, so the baby's GI tract, it's not formed very well yet, right? Like most of everything once they're born. And so until the GI tract sort of gets a little bit more used to being out here in the real world, babies have a lot of sort of cramps. And so literally if you think about, when you get your period and you have intestinal cramps and you feel that way, it's the same thing with babies. And so they tend to have sort of cramp, and they tend to have a lot more gas as well, just because that's just the way they're getting used to digesting milk and being out here in the real world. Now, the actual definition of colic is whenever you have a baby that has these episodes, and it usually happens around the exact same time of the day, and it can last an hour to 3 hours, unfortunately, and it usually starts about week 3, and it can go all the way to 3 months. And that's usually when the GI system is working better after 3 months. I mean, everyone noticed, and even at 4 months, most babies are just happier and things just work a little bit easier. And so if you have that, then sometimes you'll say, oh, my baby has colic, because it's kind of, some people call it the crazy hour, the witch hour, things like, oh, at 6 o'clock, my baby just gets kind of crazy. So what can help for that? There are several things. Number one is, white noise. We've been told that, that does help with sleep, and it just helps to calm them down. A long time ago, when my baby was born 14 years ago, we didn't have white noise machines. Yeah. And I think now it's amazing that you can carry, or it's on your phone, an app or whatever. People use like a hair dryer, literally turn on the hair dryer, and that sound calms them down for some reason, because it makes them think of the womb and when they were in there, and that's kind of what they hear of your blood going going through. And so it really does calm them down. A long time ago, they actually used to put kids on top of washing machines. Now, of course, washing machines don't make that sound anymore. But before, it did two things. It made the sound, and it shook the baby a little bit, kind of a rocker. So that if you have a colicky baby, if you do this, or if you put them in a bouncer or a swing, it tends to sort of calm them down. And I think it's just because, it balances them, so their intestines up and down. Using also a heating pad, just like a heating pad helps you're in your period, you can actually get a small, at one point a long time ago, I saw on Amazon, they actually had little ones, like literally for baby tummies. I haven't seen that in a while, but you can get whatever heating pad, actually make sure that it's not too hot. You can wrap it around a towel, whatever, but if you put some heat on the baby's tummy, that can actually soothe them. And then nowadays they have something called gripe water, which I kind of tell people it's kind of like a calming tea. It has ginger, it has phenols, so it works for a lot of things, but it works to sort of help with that cramping by it's like a smooth muscle relaxant. So it helps the intestines to relax. And then we've always heard of gas drops like Milacon, and that just kind of helps babies kind of pass gas a little bit faster. So any of those things can help too.
Are there any risk factors for colic? Or is it just some babies have it and some don't?
No, I don't think there's any risk factors for it. Some babies have it and some don't. I mean, you obviously need to talk to your doctor to make sure that there's nothing else going on with your baby, that they're screaming and yelling, right? And you're not just saying, oh, they're just colicky. But if your baby's happy otherwise the rest of the time, and it's usually only these like couple hours, but they're eating, they're growing, they're healthy, then it usually is colic. And like I said, you have to get through these months, but then eventually it gets much better after month 3 or 4.
Good. Okay, let's move on to some of the more common baby skin conditions. Someone messaged me on a video. The baby had, and my twins had it, they had very full lips, and after they would feed, it looked like it was thrush on the lips, but it was more from like pursing the lips. Have you ever seen it? It looked like it was white and raised. That's just normal. That's not anything pathologic, right? It's usually after they're
like a blister. So it
like what is it?
Like a sucking blister.
Yes.
Sucking and nursing, and sometimes that they'll get. So if it's just right here or it's usually at the top most of the time. It is normal. Now, if you notice any white inside or white in the tongue or around the cheeks, then yes, and that can be thrush, and you do need to talk to your doctor about that. But if it's only one place, then no.
What are some other signs of thrush?
Well, the main side of thrush is just white. Like if you notice a white patch. And the thing about thrush, also, the babies might not be feeding as well because it does kind of hurt. But the thing about thrush is that it tends to spread fairly quickly. And so you might notice just like one little spot in the tongue or inside of the cheek. And then you know that it moves to the other cheek, and then it moves all over the tongue. And so one good thing is if you notice white just in the tongue, sometimes that's just milk. It's not necessarily. So if it's milk, if you grab like a little towel or something and you sort of clean the baby's tongue, then you notice that it comes off. Thrush doesn't come off. And so if you notice that it's not coming off, then you do need to call your doctor, because that is a condition that needs treatment, and you need a prescription to make sure that we get rid of it.
Okay, any other, what I originally asked, any common skin conditions to look at or to be aware of that might be of concern?
Yes, there's a lot. I mean, and that are normal for babies and are not of concern. So very common. Sometimes kids get something called Erythema Toxicum, which I hate that word because it's not toxic. So I don't know who came up with it. And it's little tiny red dots that usually happen around the first 1 or 2 weeks of life, usually the first week. So you might notice it looks almost like a mosquito bite, and it's typical that they'll get it, and sometimes they'll have it like in the arm in the morning, and then it goes away, and then you have it again in the other arm, and it kind of moves around. That's a very, very normal rash. Another rash is acne. Believe it or not, kids do get baby acne, and it looks just like it would with us, except that there are smaller little pimples on the face, sometimes behind the ears, and they can even get it right here on the chest. It's not all over, but it does look kind of like greasy pimples. But again, with rashes, it is kind of tricky. So even though all of these are normal, it's hard for me to describe them, with that sort of to figure out if it's normal or not. So I would still ask your doctor to make sure that there's nothing, because there's also some illnesses that will come up with a rash, and then I would hate for someone to miss something.
Right. So yeah, I mean, skin, I've been practicing medicine for 20 years, and I still don't know anything about the skin. Because it could be anything, and I don't know. If someone comes to me with a rash, I just want to run because it's so hard to figure out. So I can imagine how it is when you have babies with rashes. I can imagine. Okay, another good one, caring for the private parts. I think we need to learn to not be scared of our baby's private parts, but we have to be able to take care of it and know if there's something abnormal. So first of all, how do you clean private parts? We could do the males versus females. And then also, is there such thing as a newborn period?
Okay.
Yeah, so, talk about that.
Yeah, absolutely. And so first of all, we'll start with boys. And so if boys are not circumcised, it's fairly easy. There's not a whole lot to do. You just really wipe around and you're done. You do not have to pull back the foreskin really until they're like after 3 years of age. And so there's no reason to do anything to your baby at all, newborn baby. If they are circumcised, after it heals, then I do recommend to sort of keep movement on the foreskin, because sometimes they can get adhesions, and then it can actually go all the way to the top where they look like not circumcised. So every time you change the diaper, just move the foreskin down a little bit just to keep movement. And then that's about it. Now, girls do become a little bit more tricky just because girls have a shorter urethra. And if we get any kind of poop or bowel movement around the vagina area, then they have more of a risk of getting a urinary tract infection.
Yes.
So we want to make sure that we always clean girls from front to back. We never go from back to front. And you don't have to clean it. So a lot of girls do have like this whitish discharge that's there. That is totally normal. And you don't have to like rub it and take it all off. It's no big deal. What you do have to make sure is that there's no stool. So clean all the yellow around it. And then as far as whether there's a baby period, absolutely. Some babies do still have some hormones from mom, and they tend to kind of have a little bit of blood just to get together, just like that little white discharge. Now, if it's a lot, or if you notice that it looks like there's some sort of bulge or something weird that's not there, I would definitely bring it up to your pediatrician, okay? So it is normal to have a little bit of blood, but sometimes there is growths or things in there that cause a lot more blood, and we need to make sure that we let them know. When does the newborn period typically occur? It can occur like from birth. I mean, it's usually the first week of life.
Okay.
First week or two. I mean, it's not going to happen like 4 months or something like that, because it's usually transfer hormones at the very beginning. And with that said, it reminded me of something really quick that's also normal. Believe it or not, sometimes babies, whether they're boys or girls, can lactate, meaning they can look like they have breasts, and if you press on them, you'll see like white, like milk looking thing coming out. It's normal. Again, it's just a hormonal thing. And usually, I mean, you don't have to drain it or press on it or nothing, but if you see it, don't freak out. It's not pus. It's not infection. And it usually goes away after the first month or so. Okay. Now, this is a loaded one, and you have about 5 minutes to answer this one, but this is a good one. Fever. Okay. I know that was one of the things that I was terrified of. When do you need to be concerned about a fever, and when does a fever need to be treated? Right. So good. I did a 1 minute video on my Instagram on this, so we're good. Okay.
Good.
So fever, first of all, is not dangerous. Okay. Fever is actually a symptom that something is going on with your system, you know, with your body. There's a virus, there's something going on. And this is just a symptom. And it actually means that your immune system is working. Okay. So it's a good thing actually to get a fever. It's like a natural antibiotic. Okay. Now, what happens is when we have newborns less than 2 months of age, fever is considered an emergency. And the reason is because babies that are less than 2 months of age, their immune system doesn't work very well. So any little virus, and it doesn't have to be COVID, okay? It can be anything, can turn into like meningitis or something really bad. So if a baby less than 2 months old has a fever, then that's the only time that it's considered an emergency, and you have to call your pediatrician or you have to go to emergency room.
What's a fever though? Yeah,
exactly. So what is a fever is anything over 100.4 rectally. So every thermometer that they gave you in your baby shower, the one here, the sucker one, whatever, put them in a drawer. They're great. You'll use them when your kids are older. But when your kid's baby, the best thermometer is a $1 CVS thermometer with a little bit of Vaseline. Your baby does not mind if you take a rectal temperature. You might, and you might feel really yucky. I promise. You just put the tip on it, and you want to get a rectal temperature. Again, you don't have to be taking the temperature every day. So this is not something you do daily. After your baby leaves the hospital, then that means that they're doing well. Only if they're not eating good or if you feel like they're hot, but then it's a rectal temperature. Now, after 2 months, fever is not an emergency. So we never treat a number. We only treat a child. So I have kids in my office with fever of 103, running around, fine, could care less. And so if they're doing okay, you don't have to treat it because it's 103. You treat it just because the child's feeling bad. And so we give Tylenol or Motrin to make the child feel better, because most of the time at 103, you feel really crappy. And then you don't want to drink. So then we run the risk of kids getting dehydrated because they're not eating or drinking. So we're treating, you know, the kid to make sure that they don't get dehydrated or whatever, but not because fever is dangerous or fever is an emergency. It's only an emergency less than 2 months of age.
Good. Okay. Well, you actually summarize that really quick. So I have time to scooch one more question. First year of life, you know, everybody talks about milestones, and I know parents compare their children and they talk, and if one kid's doing something and your kid's not, you go home and you start accosting Dr. Google trying to figure out what's wrong with your kid. Right. And we have to understand every kid's different and we can't compare, first of all. But what is the best way as a parent, especially if you're a new parent and you have nothing to compare to, what's the best way to keep track of your child's developmental milestones in that first year, and when you might be concerned or there might be a red flag? Okay. Well, I mean, there's all kinds of websites, honestly, that you can look at, or if you Google, you know, milestones. The most important thing, I mean, people always think about, you know, rolling over at 4 months, you know, pulling up to stand at 9 months. But you have to realize that even though there's a number, because when you write a book, you have to put some sort of a number, there's actually a big range, or like walking a year. But it's normal from 12 months to 18 months. Some babies don't walk until they're 18 months, and it's still considered normal. Okay. And so you have to look that there's a range of normal, and some babies walk at 9 months and they walk super, you know, and so every baby has their own journey. Every baby, you have to make sure that we are just sort of there. You know, there are some red flags for us pediatricians, and that's why I think it's very important that instead of just reading a book because you're not sure, is that you ask your pediatrician, you make sure that they are talking to you about their milestones. And it's not just your baby's breathing, your baby's good, here's the next shots, go home, right? Because sometimes, and I have seen it happen in the practice where I used to work, where someone was really, really busy, and he was one of my best friend's child who had a genetic disorder, and it was missed because the mom never brought it up. And so if you don't have a pediatrician, you know, that has a lot more time, sometimes some pediatricians are really busy. And if the mom doesn't say, hey, I'm worried because my kid's not rolling over and my kid's now 9 months old, and the pediatrician doesn't ask, you see them for 5 minutes, you just assume that they're rolling over, but you don't know. So just make sure that you're proactive as a mom. I can't stress enough. And you ask questions. And if your pediatrician blows you off or doesn't have time, then you find someone else. I agree. I mean, one thing that my pediatrician's office does is they either go through a checklist verbally with you, or they have you fill out the forms. So if your pediatrician's office is not doing one of those two things as you're going in that first year, especially that first year of life, then something's not quite right, because the doctor may not have time to physically go through that with you, but their staff can, their nurse can, because a lot of times they see you more than for longer than the pediatrician does, right? And then at least they should be having you fill out the questionnaires so that you know that they're looking at those questionnaires and making sure there's no red flags in the questionnaires. Okay, one more question real quick. Flatheads and helmets. We're not going to talk about preemies, because preemies are a little bit different. They're more prone to that for obvious reasons. But I've seen a lot of term babies with some flat heads, and you know, as a doctor, I notice it. And when do you need to be concerned, and how can you prevent? And it might not just, when we think of a flat head, we think about it here, but it can be in any part of the baby's head, right? So what can we do, especially as new parents, to make sure that we keep that head rounded, or when to be worried that maybe there is becoming a flat area that might need attention?
Right. So the first thing that you can do is that we need to start doing tummy time from day one. And when they're really little, tummy time is usually on you, because they don't have the strength yet to really be in a horizontal position. Now, some babies might be ready to do tummy time on a flat surface by a month. Some babies are not ready until 2 months, okay? And you'll sort of know, and your pediatrician can guide you with that. But definitely most babies by 2 months should have, term baby, enough strength to be able to sit in a horizontal position. Some babies hate tummy time, and we need to learn how to distract them, how to make it happen. So if you put your baby, like my son, again, here we go, I'm going to use him again. He had to use a helmet, and it's because we had a nanny, and he hated tummy time, and they would put him on tummy time, he would fuss, and she would pick him up immediately because she didn't want him to fuss. So he never did tummy time. And so what happens is these kids that don't spend most of the day on their back. They spend all night on their back, because back to sleep is the safest thing. And during the day, you're putting them on a bouncer, on a car seat, a swing, again, on their back. So we need to make sure we're changing position. And by putting them on tummy time is the best way to prevent it. Now, some babies also are born with something called torticollis, which means that a muscle right here, it's a little bit shorter, and they might not be able to move all the way around, and you might not notice it because sometimes it's really subtle. And so they like to only lay on this side. And so they'll only lay on this side, because if they lay on this side, it hurts because the muscle has like a crook in it. And so that point, there's a lot of physical therapists that work with babies to just get that muscles, you know, stretch it, and they're able to move, and you're able to change. But really, it's changing positions to make sure, because the baby's head is like Play-Doh, right? And so if you put too much pressure on here, eventually this is going to be flat, and this is going to be a little bit bulky. So that's why helmets work if your baby needs it, because what they do is that make a helmet special, where they put pressure wherever it's too big, space open. So essentially, as the baby's head is growing, then it becomes, you know, appropriately how it needs to.
Because it.
So yeah, but tummy time, I can express.
Yes. Perfect. All right, let's go through and answer some questions. Let me see. Go back up.
I love this. Nick, you respect for pediatricians. Amen.
So you're gonna, I'll put in the comments of this video some of the apps or logs that Dr. España recommends for the feeding, and if you have anything for sleep or any kind of apps that you think are really good for those first few months of life.
Absolutely.
Can you pump and thicken breast milk for babies who spit up? I've seen drops. Yeah, discuss the whole thickening the milk.
Yeah, and so you can, I mean, this is a little bit controversial. Some people think that it doesn't work. I am one of the ones that thinks that I think it absolutely does work. I've seen it happen with my own child. And so essentially, you know, breast milk, it's pretty watery. And so if you think about reflux in babies, it's very different than reflux in adults, right? Reflux in babies is just that muscle is not strong enough. And so the muscle is supposed to get really tight and not let anything come back up. So that muscle, it's just not strong enough, because it needs to get stronger as they get bigger. And you add to it that all you drink is milk, so it's water, so it comes back up. So if you were to x-ray any baby and look at it, every single baby has milk that comes up and down, absolutely all day long. It just happens, okay? Now, some babies have it worse than others, and they're spitting up or whatever. So the idea is if you pump and then you can add rice cereal to the milk, or they actually have some milk fortifiers that actually make it thicker, then you're making the milk thicker so it stays down easier and it doesn't come back up as easy. And that is the idea of, the formula. They make formula for reflux as well.
Yes.
For reflux, it's just simply a formula that it's thicker and it has some sort of rice cereal added to it. So then the idea is that it's heavier and it stays down so it doesn't come up as easy.
Yeah, good. Yeah, I forgot we had to do that with Remy with the formula. So my daughter didn't have the issue, he did, but it wasn't too terribly bad. But I've heard of some of my friends and colleagues who've had babies with horrible reflux, and yeah, they either, depending on the pediatrician, they can not supplement it, but thicken it or buy the formula that's thicker.
Right.
Okay, so what I want to talk about real quick is your program, your concierge pediatrics in Houston, but you have a program called Your Baby and You. Tell me about it.
Right. So I used to run my concierge pediatric practice, and I quit you as a pediatrician. My passion is actually giving moms the tools and really educating and spending time with them. And so their stress level comes down, because it is pretty stressful to have a newborn. And then, they don't come with a manual, right? Like I'll joke with them. I'm like, you didn't push the manual out? Like they didn't give you. And they don't. So it doesn't matter how many courses or whatever, once your baby's in your arms, you always have a million questions. And I've noticed that it always seems to be very similar questions, like the ones that you were asking today. And so my quarantine project, while I was sitting at home and my office was closed and I was only doing telemedicine, is I started making videos, because I also have an Instagram account, and people used to say, we really like your videos just like you do. So I decided to make videos, and it turned out to be 44 videos that talk about the most common questions a first-time mom has. So we talk about breastfeeding and feeding and reflux, and should your baby have a pacifier? How do I cut my baby's nails? How often should I bathe them? I mean, a lot of similar questions, and honestly, most baby books have all those answers. It's just nowadays people don't want to read a long book or don't have time. So I thought it would be really cool to have a way where you can just click on it and have index and say, well, I want to hear about colic. And you click on it, and you can do it while you're breastfeeding, while you're cooking, while you're taking a shower, whatever. And you can listen to a 5-7 minute video. And you know that it's coming from a pediatrician. It's not random Google, whatever.
Yes.
There is good information on Google. The problem is, how do you decipher what's good and what's not?
Right.
And you really have the time to do that. So this has been out there. I have it both in Spanish and English, because I do speak Spanish as well. So if anyone's interested in Spanish, definitely. I know you're going to post the English version, but if you want the Spanish version, you can DM me at Concierge Pediatrics, and I can definitely send it to you. And I am going to we do have a coupon available for everybody that follows you, where they're going to get $10 off. The course is $79, and you get all 44 videos, and you can get $10 off if you get this coupon.
Yeah, so I will put the link in my stories to the course, and it will automatically take the $10 off. But if something that it doesn't, the code is actually spring special. But I'll put that all in the comments on this video, and also I'll make a post for my stories. If you don't get this right away and you're watching it later down the road, what you can do is go to my newborn highlight, and this video with all that information will be there as well.
Cool. Now I do want to say one more thing, and I want to take advantage that we have, a lot of, pregnant moms or new moms, I guess, that follow you, is that the course has been great, and I've gotten a lot of really good feedback of people liking it. But again, my passion, I just noticed that nowadays, because the way that medicine works, and I was that pediatrician that took 10 minutes to see your baby because I had 40 other kids to see. Yeah. I feel like there's just not that part of pediatrics that we general pediatricians want to really educate, spend the time with you, and hold your hand. And so I've been racking my brain as how I could give more support to new moms that are not necessarily my patients. Because if you live in Houston and you want to come to Concierge Pediatrics, I spend an hour with every single checkup, and I can talk about everything, right? But if you don't live in Houston, or you don't want a concierge pediatrician, what could I do? And so I'm in the process, and it hasn't launched yet, but I would love some opinions of any of you guys if you want to DM me and give me opinions. But the idea is that I am going to create something that would involve the course, of course, that you have all the videos, but it would also involve like office hours with me. And so people want to buy a package that it can be either for 3 months, 6 months, or have me for a whole year. I would have certain times, obviously, during the week that I would set up and say, you can make an appointment to discuss a child for 20 minutes with me. Obviously, I'm not your pediatrician, so I cannot diagnose him, I cannot treat. But every, things about development, newborn, or a lot of the questions that we're talking right now, we can definitely discuss to, and again, my whole purpose is it's just to bring your stress level down. It's stressful enough to have a newborn.
Yeah.
If you don't have anyone to talk to that you trust, then it's just even more stressful. So that's sort of in the progress.
Works, yeah.
And the works. And I definitely would love your opinion. So send me a DM, and I promise I do have to bolt. And the reason I have to leave is I have to take my aunt to go get her COVID shot. So that's why I have to leave.
Good.
At 12:45. But I will go through the comments. I will answer every single question. I will put in there the apps that I think are, that I like to record, feedings and all that stuff. And then go to @ConciergePediatrics on Instagram and then DM me any ideas or anything that you think, because I'm here to honestly to just serve and help new moms. So if you're like, you know what, Dr. España, it'd be awesome if you could include this, and we would really like this. It would be much appreciated.
Well, thank you. And I'll let you go because I'm not going to hold anybody back from getting vaccinated. You know how I feel about that. So thank you for taking your aunt. And we will do this again when you are ready to relaunch or launch the new product you're having. I'm going to have you back. Perfect. Have a great day.
Sounds great. Anytime. Okay. Bye, you too.
Bye-bye.